you all was, why did Lee Health do something like this, and why did they partner with another organization to bring a service into the community? And I think that the main reason to that, main response to that is that healthcare right now in the nation is in a state of disruption. The services that have been traditionally provided in the past really need to be expanded because we're not able to meet the needs of the community and of the nation in general. And so hospitals that used to be the go-to place for everything, if you can recall many years ago, you know, if you got a little sick, you would go to the hospital, they would, you know, fix you up, and then you would go home. That's really not the way that healthcare is going to look in 6 months or 10 years. Hospitals are really supposed to provide care for the sickest people. They're not supposed to provide care for people that need to have urgent care, non-emergent care, or really can be treated in their home setting. Keeping people in their homes is much preferable than bringing them into a large hospital. And that's why Lee Health partnered with Dispatch Health. It's sort of a disruptive way of providing care in people's homes. And Dispatch Health is a national organization, and they do it very well, as we're going to talk about. So we have 3 programs at Lee Health that we are partnering with Dispatch Health to provide. The one is the acute care or urgent care program, and that is for folks that have an urgent illness similar to something that you would go to the urgent care center for, or maybe even your primary care's office. You probably try to call your primary doctor first and see if you can get in to see your primary care doctor, but if you can't get in quickly, we don't want you to get sicker. And if you get sicker, you're going to wind up in the emergency department. So the whole idea is to prevent you from getting sicker and get you the care that you need when you need it. So the cost to the patient is in line with an urgent care copay visit if you're in network, and I'll show you they have a large number of insurance companies that they're actually in network with. And we include the Lee Employee Health Plan if somebody works for Lee Health, Vivita, WellCare, Humana, AvMed, United, Devoted, Bright, WellMed, and lots of other insurance companies. And if it's self-pay, it's $275 for the visit, which is comparable to a self-pay visit in urgent care. We have another program, again, trying to keep people healthy, and it's called Bridge Care. And Bridge Care is for patients that are leaving the acute care setting and they are going to go home. So we'd like to give them some in-between care between the time that they're discharged from the hospital until they get to their primary care doctor for their follow-up. So it's not home health, it's to have a provider actually come out, just give them a quick look over, make sure that they're understanding their discharge treatment plan, understand what they're supposed to do when they get home, make sure that they're not slipping backwards and everything is on track. And that's that intermediate care between the time that the patient is discharged until the time that the patient's seen in their doctor's office. This is something that's restricted to Medicare only, and so the care managers in the hospital assess the patient with the physician to see if the patient would be a good candidate for something like this. Some people don't need it, some people really benefit from it. And then the last program is called Emergency Department Home to Dispatch Health. And this is for folks that are coming in, they get their screening in the emergency department by the physician or the advanced provider, and they say, you know, we really think that you would do well at home with an urgent care type visit with Dispatch Health. Is this something that you would be amenable to? And they say, yes, you didn't need major services in the emergency department. We can provide you some services at your house at a much lower cost. And then the care managers work to coordinate something like that. So it's pretty innovative. We give the patients education about same day at home for medical care, trying to continue your recovery at home depending upon which program that you're going with. And again, the whole idea is to keep people healthy and keep them out of the hospital whenever possible. Provide the right service at the right place at the right time. So Dispatch Health is able to do high acuity treatments and capabilities. Pretty much anything that you're able to get in the urgent care setting, you can get from Dispatch Health, and they'll help you understand that. They do, when you call, if you're calling for an urgent visit, they do talk to you on the phone a little bit to see what your needs are and determine whether or not you're able to be treated by their providers, or they might suggest that maybe you're a little too sick and you should go someplace else. Also, if Dispatch Health comes and actually does the assessment at your house and you are sicker and do require emergency department services, then they will notify 911 and wait with you while EMS is on their way to make sure that you don't have a problem. And then they'll give report off to EMS so that everybody understands what's going on, and it sort of expedites the process. So it's a really great program. The care team at Dispatch Health, they have advanced providers, they have a medical technician, and then they also have a virtual physician. So they can contact their physician first to run it by if it's a little bit above the scope or the advanced provider needs something else, more input and feedback. So it's a very well-rounded, well-balanced program. Frequent complaints that they care of, maybe you're out in your yard working and you got dehydrated and you're not feeling well and you're feeling bad. That might be something that they take care of. General illnesses, fevers. They were getting a lot of calls back when we were having surges for people that had COVID symptoms. Lots of different things. Belly pain, headaches, uncomplicated fractures and sprains, the types of things that you would get taken care of if you went to the urgent care center. Now, obviously, if you broke your arm and the bone is sticking out, that's probably not an uncomplicated fracture, right? So it's just some things that you would be able to get taken care of at an urgent care center. We do have different ways at Lee Health for you to request a visit. So Lee Health has different ways for you to request a visit even at your primary care or one of your specialty offices. There's two different apps that we have. The first app is the Lee Health app, and in the Lee Health app you can go right in and you can schedule a visit. So you go to the home page of it, there's a health and wellness section, and then you go to Dispatch Health and then schedule a visit, and you can put in the visit right there. So that's the Lee Health app that you can get on your phone. We also have MyChart. And so if you're a Lee Health physician group patient, you're probably familiar with MyChart. Very similar, where you go to schedule appointment. It's up on the top, schedule appointments. It takes you to the front page, and then you'll see that it says introducing Dispatch Health Urgent Care at Home. And then there's where the arrow is pointing down, it says to schedule an appointment, click here. You click there and it takes you right out to schedule an appointment. So we're trying to make it as convenient as possible. You can also dial a phone number. So the best thing about Dispatch Health is, again, it's innovative, and we are collaborating with Dispatch Health. So it's a service that's provided through Lee Health, and we want to make sure that we can tuck you back into your care team when you're done. So Dispatch Health is able to provide a report that goes back into something called Care Everywhere. So it's available to any physician that participates in Epic, and your physicians can pull it right up through Care Anywhere, and they can see the whole entire encounter and what happened to the patient at their home. And so that way your provider gets feedback, so they understand what happened. Same as if you would go to if you went to Lee Health Coconut Point to the urgent care center, the same thing would happen, that your physician would be able to get feedback about what happened to you. This was through March, and through March we started in August. Through March we had seen a total of 1,510 patients, and I just found out as we summed up last month that we're actually over 2,000 patients so far. So this is providing a tremendous service to the community, and we see a lot of patients every month. The next thing is kind of interesting. This is actually information that's derived from the patient surveys. So when dispatch arrives at the house, they talk to the patients. And we try and avoid unnecessary care utilization. So like I said, you don't need to go to the emergency department for minor illnesses or things that you can be treated in urgent care. So they ask, where would you have gone if you would not have called Dispatch Health? 50% of the patients said that they would have gone to the emergency department. So you know what the lines in the emergency departments are. We have to take care of very, very sick patients. So you avoided a lot of extra costs, a lot of inconvenience, a lot of wait, and it got you the care when you needed it just as soon as possible. 911, 15% of the people said that they would have called 911. So that's another similar situation that's actually gonna put you over into the emergency department should you need to have care. So the dispatch health, when you call them, they actually use the same, we call it triage program. Their operators on the phone, when they answer it, they use the same triage program as our Lee Health nurse triage nurses. If you called the call center to make an appointment and you said, oh, I have a terrible headache, then they would transfer you over to a nurse to talk through and go through this algorithm that lets us know where the best place for you to receive care. Their operators do the same exact thing. So they have a very good, very reliable, evidence-based program that helps us determine where your care would be met at the best place. And then these are all of the insurance companies that they partner with, at least as of the last 2 months ago when I did this presentation. And they do add new providers all the time. We're working with them now. The Blues are a big provider, as is Cigna in Lee County, and so we're working with them. I don't think that they're currently in the Florida Cigna or the Blues. They're working to get enrolled in some of those more popular insurance agencies that we have now. And I think that's it. There was one more, but really, the other thing is they do a survey, and it's something that's a national survey, and it gives us a net promoter score, and that really lets us know how satisfied patients are with their service. And their average score for our patients that they're seeing here in Lee County is 98 to 100. They provide an excellent service,